Joining me now is former Democratic presidential candidate Senator Bernie Sanders of Vermont. Senator Sanders, thanks so much for joining us.
My pleasure.
So earlier today, both the chairman and the ranking Democrat on the House Intelligence Committee said that they know of no evidence that President Trump was wiretapped during the Obama administration. What's your reaction?
I am not shocked. I mean, I think we have a president who says things time and time again that have no basis in fact, and there is no evidence behind them. I think it's a very sad and dangerous state of affairs, Jake, because the day is going to come when some tragedy is going to befall our country and the world, and people are not going to believe this president. So I would hope that the advisors to the president tell him, you just can't say anything you want to say if it's not true, and that's got to change.
Do you think President Trump needs to retract the statement and apologize to President Obama?
Among many other statements. Time after time, what he says is factually untrue. He lies. And I say that not with any political partisanship here, just a fact. You cannot say anything you want to say, which is not backed up by evidence. And he does this time and time again. This is dangerous, because there will be a day when something real happens. He's going to tell the American people, oh, it's just Donald Trump. He's lying again. Who believes him? It's bad stuff.
Senator Sanders, stick around. We've got lots more to discuss, including, of course, the Republican plan to repeal and replace Obamacare. That's next. Stay with us. And welcome back. We're back with former Democratic presidential candidate Senator Bernie Sanders of Vermont. Senator, let's turn to health care, the debate going on right now on Capitol Hill. A lot is being made out of the Congressional Budget Office estimate that there will be 24 million more uninsured Americans within a decade if the Republican plan goes forward. But the CBO also says that a portion of those 24 million will be individuals who want out of the insurance market, who voluntarily drop out, and who are only buying insurance now under threat of penalty. Theoretically, why shouldn't Americans have the freedom to not buy health insurance if they don't want to?
Well, theoretically, in my view, Jake, the United States should join every other major country and guarantee health care to all people as a right. Now, it is understandable that if you're young and you're healthy and you don't have a lot of money, you would say, well, you know what, I don't need to buy health insurance. But on the other hand, you can get hit by a bus tomorrow and end up in bankruptcy, having your credit rating destroyed. So I think what most Americans believe, and certainly people all over the world believe, health care is a right. Now, what is disturbing also is that while it is true some may voluntarily drop out, the other truth is that older people, according to the AARP, people who are making about $26,000 a year, will be forced to pay $7,000 a year more than they're currently paying for the same health care. In other words, the cost of health insurance for older people is going to rise precipitously. And many of those people are going to drop out, not voluntarily. It's just that they cannot afford the health care they need. Imagine being 60 years of age and not being able to afford the health care that you need. That is part of what the Republican program is. Bottom line is, though, that our goal should be to provide health insurance to all people, not to throw 24 million people off of health insurance, raise rates for older people, defund Planned Parenthood, decimate Medicaid, and take people who today are getting opiate treatments off of the treatment they're currently getting. This is not, Jake, and we should be clear about this, this is not health care reform. You don't throw 24 million people off of health care and call it reform. This is tax reform, providing $275 billion in tax breaks for the top 2% at a time of massive income and wealth inequality. It is a grotesque and ugly plan. And let me conclude by saying this. If you are old and you have no health insurance, you're 55, 60 years of age, and you have no health insurance and you're sick, you will die. You may die because you can't get to a doctor when you should.
Well, let me ask you about that, Senator, because you've said that if this repeal and replace plan goes forward, thousands of Americans will die. Where do you get that estimate from?
I get that estimate from the fact that studies have been done that people who do not have health insurance, who do not go to the doctor when they should, who do not go to the hospital when they need to go, in fact die. And thousands of people die every year because they don't have health insurance. And if you throw 24 million people off of health insurance, there is no doubt that many thousands of people will die. Look, Jake, I have talked to doctors in Vermont and all over this country who see patients who walk in the door and they're really sick, and the doctor says, why didn't you come in when you first had your symptom? And when the patient says, well, I had a high deductible or I didn't have any health insurance, I didn't want to come in. Sometimes it is too late to treat those people.
Senator, but you know that in many states, Obamacare is in dire straits. The governor of Minnesota, a liberal Democrat, said that the Affordable Care Act is unaffordable.
Right.
According to HHS, in 2017, there's going to be a nearly 25% decline in the number of insurers participating in Obamacare compared to 2016. Don't Democrats own this bill that in many states is failing?
No, I think what what you're saying is true. No one denies, certainly not me, that the Affordable Care Act, Obamacare, has many serious problems. Deductibles are too high, premiums are too high, we still have too many people who don't have any health insurance, it's too complicated, it's too bureaucratic. Let's sit down and address those issues. There are many working people who under the Affordable Care Act cannot afford their health care. That's true. Let's deal with that. The solution is not to throw 24 million people off of health insurance and substantially raise premiums for older workers, and furthermore to cut Medicare, to cut Planned Parenthood, to defund Planned Parenthood and throw millions of people off of their choice of health care right now.
Senator, let me ask you, you talked about the high deductibles. Republicans say that many of the people who were mandated to get insurance under Obamacare and right now currently count as individuals who have health insurance were basically not able to get any access to health care.
That's right.
Because the deductibles are so high. So in effect, they're counted as having health insurance, but really they had no access to care.
Well, that's a very fair point, Jake, and that will be made worse by this so-called, Republican plan. What the Republicans will say is, okay, you have health insurance, but what you have is a catastrophic plan, and you have $10,000 deduction. So the point is, this is one of the crises that we face now. It will only be made worse under the Republican plan. And that is that people today have very, very high deductibles, which prevents them from going to the doctor when they should. Furthermore, let me add to that, that in many rural areas of this country, you can have a great insurance program, but you can't find a doctor because we are medically underserved and we don't have enough primary health care physicians.
Senator Bernie Sanders of Vermont, thank you so much. Appreciate your time.
Thank you.
Even the White House is now signaling that the House Republican health care bill will not get through the Senate in its current form. So what is House Speaker Paul Ryan to do? He'll join us live in just a few minutes. Plus, from taking apart NBA refs to taking on President Trump, what does Mark Cuban think about the new information about Mr. Trump's taxes and much more? He'll join us live next. Thanks, Brooke. Can Donald Trump sell the health care plan the same way he sold himself to voters? And is he even willing to try? The lead starts right now. President Trump in his element, hitting the campaign trail, expecting to sell a health care plan tonight, one that he's not yet willing to put his name on, leaving the House Speaker to deal with the fallout in Washington. Paul Ryan's going to join us live in just minutes. No evidence. House Intelligence Committee leaders, including one Trump supporter, say there is no proof the president told the truth when he accused President Obama of wiretapping him at Trump Tower. Plus, this town is run by elephants and donkeys, but today we have a shark, Mark Cuban, talking to us about President Trump's taxes, his leadership, and what he thinks the president is really worth. Good afternoon, everyone. Welcome to The Lead. I'm Jake Tapper. Topping our politics lead today, President Trump is taking his act to Nashville as he tries to sell his Obamacare repeal and replace plan, the plan that his White House does not want us to call Trump Care. Perhaps that's because back in Washington, support for the plan looks increasingly shaky, especially after the Congressional Budget Office report that says 24 million fewer Americans will have health insurance under the Republicans' plan. As House leaders face the dilemma of moderates and conservatives in their party who each want to make changes that might alienate the other bloc. For its part, the White House wants to negotiate, but some prominent Trump supporters now seem prepared to call the legislation a failure and hang it around the neck of House Speaker Paul Ryan. CNN correspondent Sunlen Serfati is live on Capitol Hill. And Sunlen, the president gave a speech in Michigan today. Did he even mention the health care plan?
He did not, Jake. Not one single word about health care today. It is first of two stops today. And frankly, this is a time when the president needs to be out fully selling his health care plan. Opposition is growing up here on Capitol Hill, especially opposition among Republicans.
Tonight, President Trump hitting the road and Vice President Pence working Capitol Hill, facing the same ominous question.
Are you concerned this doesn't have the votes to pass, Mr. Vice President?
With the Republican health care plan hanging tenuously in the balance,
they don't have our votes, but more importantly, they need to discover they do not have your votes.
opposition in Congress is growing by the day.
I'm leaning no because I don't think the current bill can pass in the Senate. I think that the bill has to be strengthened.
The House bill in its current form can only afford to lose 21 Republican votes. According to CNN's latest whip count, already 18 House Republicans have said no or are leaning that way. And Speaker of the House Paul Ryan's bill faces an even steeper climb in the Senate.
I don't think anyone believes its current form would pass in the U.S. Senate.
Sources tell CNN privately the White House is encouraging leadership to make more changes now, acknowledging the current House bill cannot pass in the Senate.
They aren't only writing a bill for 218 votes in the House of Representatives. They got to be writing a bill that gets 51 votes and Republican votes in the United States Senate.
A senior Republican aide telling CNN the White House is, quote, definitely looking at pretty big changes to the Ryan bill. But Speaker Ryan is standing firm.
We want to listen to our members and make improvements to the bill so long as those improvements don't make the bill harder to pass.
Pushing ahead with his bill with little or no changes.
This is why we have a three-part process. You can't put everything you want in that bill, like, say, interstate shopping across state lines. And so this bill is what we can pass through reconciliation.
Republican Senator Lindsey Graham today completely crushing that promise to pass more legislation later on.
Slow down, get it right. You're not going to get 60 votes to buy insurance across state lines. That is a fantasy in the Senate. If you think that's important to health care reform, it's never going to happen in the Senate.
And to give you an indication of just how intense all the movement on up here on Capitol Hill on all of this is, you have Vice President Pence, who will be spending the majority of his day up here right now meeting with individual members trying to sell this bill. Later he meets with a full Republican conference. We have Speaker of the House Paul Ryan. He's set to hold an evening press conference with the latest. All this going into a hugely significant day up here. Tomorrow, Jake, you have the House Budget Committee who will start to mark up their portion of the bill. That's essential because that is potentially the last step before this bill reaches the full House floor. Jake?
All right, Sunlen Serfati on Capitol Hill for us. Thank you so much. And House Speaker Paul Ryan will join me live in just a few minutes to discuss the House Republican health care bill. Stick around. As difficult a task as President Trump might be having pitching his health care bill to voters, it is nothing compared to convincing skeptics, even those in his own party and his administration, of the veracity of his wild and apparently false charge that President Obama had him wiretapped at Trump Tower during the election. This morning, leaders of the House Intelligence Committee reaffirmed that they have seen absolutely zero evidence proving President Trump's claims. This comes as right now FBI Director James Comey is briefing members of the Senate Judiciary Committee behind closed doors. CNN's Manu Raju joins me now live from Capitol Hill. Manu, do we know the focus of this meeting?
Well, Jake, the reason for this meeting is because of frustration voiced by the Senate Judiciary Chairman Chuck Grassley that he was not getting enough information about what the FBI was doing in its investigations, including any investigations that are ongoing about Russia and its ties to the Trump campaign. Now, Grassley had threatened to hold up the number 2 nominee at the Justice Department, Rod Rosenstein, to be the Deputy Attorney General if he didn't get a briefing. And so as a result, James Comey here behind closed doors in a classified setting with Dianne Feinstein, the top Democrat on the committee, will see if they answer the key question that some members on the Judiciary Committee were hoping to get today. Is there actually an investigation ongoing into the Trump campaign? That answer did not come by this afternoon, a deadline that apparently Comey gave to Sheldon Whitehouse, a Democrat on the committee. We'll see if he does it in this classified briefing that's happening right now, Jake.
And Manu, earlier today we heard some rare agreement from Democrats and Republicans on the fact that There doesn't appear to be any evidence for the president's wiretapping charge.
Yeah, that's right. The House Intelligence Committee making a pretty strong statement, including the Republican chairman, Devin Nunes, who actually has not gone as far as he did today by saying he does not believe that Donald Trump that was wiretapped under the orders of Barack Obama. I asked him, what gives you that confidence? Take a listen.
We don't have any evidence that that took place, and in fact, I don't believe, just in the last week of time, the people we've talked to, I don't think there was an actual tap of Trump Tower. President Obama wouldn't physically go over and wiretap Trump Tower, so now you have to decide, as I mentioned to you last week, are you going to take the tweets literally? And if you are, then clearly the president was wrong.
Now, the committee actually asked the Department of Justice to provide any information by this past Monday to support the President Trump's claim. They did not get that information. Now they want it by next Monday, which is when Comey and other top officials will be testifying in a public setting in the House Intelligence Committee. If they don't get that information there, they said they may subpoena for that information. That's something the Senate Judiciary Subcommittee also is threatening as well if they don't get that information about any evidence of wiretapping, Jake.
All right, and Manu, the House Intelligence Committee Chairman Nunes and the ranking member, Democratic Congressman Adam Schiff, they seem to have very different views on whether it can be ruled out that there was any communications between members of the Trump team and campaign and Russia.
Yeah, and that's a central aspect of this ongoing House Intelligence Committee investigation. Devin Nunes, the Republican chairman, really batting down the idea of any contacts, something that his Democratic counterpart really is not there quite yet. This is our exchange from earlier today. Is there anything you've seen in the evidence so far that suggests that there are any conversations between people affiliated with the Trump campaign, people, Russian officials who are not the ambassador to Russia?
Not that I'm aware of.
You know, I wouldn't answer that question as categorically as my colleague, and you know, we're not privileged to talk about the contents of the investigation, but I think we need to be very precise when we talk about this, and I just don't think we can answer categorically and not in this forum.
Now, one area that Adam Schiff is concerned about, Jake, are contacts that apparently occurred between Roger Stone, a Trump advisor, and Russian officials, a Russian hacker, apparently during the campaign season. That's something that Adam Schiff raised significant concerns when I asked him about that at the press conference. But Devin Nunes said he's not so concerned. He said he barely knows who Roger Stone is. So it shows some disagreement along partisan lines on this investigation, and we'll see what they eventually can agree upon and eventually decide to disclose, Jake.
All right, Manu Raju on Capitol Hill. Thanks so much. Glimpse at President Trump's financials after tax reporter David K. Johnston mysteriously received a couple of pages of Donald Trump's 2005 tax return through the mail, according to him. He presented the pages to MSNBC last night. They show in 2005 Mr. Trump paid $38 million in federal income taxes on a reported income of $150 million. Joining me now to talk about it is investor, one of the hosts of Shark Tank, owner of the Dallas Mavericks, star of Billions and Sharknado 3, Mark Cuban. Thanks for joining us. Appreciate it.
Thanks for having me, Jake.
So what do you make of the returns?
We had a good year, right? And that's all you can say about it. I mean, anybody who makes $150 million, you applaud them and you say congratulations, and you know how well they did that year, and it really doesn't tell you anything else.
He paid an effective tax rate of 25%.
Right.
Turns out, we looked at some other people whose tax returns we've seen. That's a higher rate than Mitt Romney paid in 2011, higher than Bernie Sanders in 2014. But you have to look at the logic,
right? So if you know that you're going to have a big windfall, like he sold a big building that year, you're going to aggregate all your expenses to push down. And because of the alternative minimum tax, you can only get it down so low in certain circumstances. So really comparing rates is apples to oranges. There's really not a purpose in doing that.
You have been a very vocal skeptic of President Trump's claims to be a billionaire, much less 10 times older. If he made $150 million in 2005, is that the tax return of somebody who might be worth $1 billion?
You don't know, right? Because, I read somewhere that he sold a building with his Japanese partners that year. He might have gotten an advance from The Apprentice that year. You manage things like, my attitude has always been you let your winners ride and you only sell when you need to. So I've had some years that I've had huge numbers and other years where you know, my income was far less. So you can't really tell because you try to manage to what your taxes are going to be in a lot of respects.
You mentioned the AMT, the alternative minimum tax. A lot of people out there might not know what that is. President Trump wants to get rid of it. He would have paid much, much less than 25% if the AMT didn't exist.
Yeah, I mean, you know, you can argue both ways. It's kind of annoying when you have to write that big check when you think you've got offsetting deductions. But look, I don't have a problem paying taxes. I don't have a problem where tax rates are at right now for personal taxes. I like to see corporate taxes much lower. I like to see inversions from companies moving be far fewer. So yeah, so from a corporate tax perspective, and you know, I agree with him. I like what he's doing from that perspective, and we'll see what he does on the personal side.
Let's talk about the Trump administration. You obviously were a big supporter of Hillary Clinton. We're about 7 weeks into the Trump administration. What do you think?
No leadership skills, no management skills, not very good communication skills. But he's obviously had an impact on the economy, so he gets credit for that. People believe in what he's doing on the tax front. They believe, and I agree on the reduction of regulation. Not all regulation, the EPA type stuff I don't agree with, but in some of it, the simplification of doing business I agree with. Reducing reducing some of the bureaucracy and the lobbying rules. There's a lot of positives that are positives for business. But you still have to look at the bigger picture, because even though he's put out these executive orders, even though he's signaled the intent to do all these things, and the market has believed in it, any leader, particularly the president, has got to lead, and he's got to get these things passed. And we're seeing the difficulties of his communication skills with what we're seeing with Obamacare versus Trump care.
Well, let's talk about, I mean, you said no leadership skills, no management skills, no communication skills. Let's start with leadership skills. Where are the leadership skills wanting in your view?
Well, the first thing you look at is the leaks, right? I think in any organization...
From the White House, the ones from the White House.
From the White House, right? Yeah. So any organization, I've been in takeover scenarios, companies where I've purchased, where there's been bad culture, right? You've got to sit down, and where people disagree with you, you've got to say, look, there's going to be issues, but let's discuss this. We'll communicate so that you don't have to communicate with the public. If you have a problem, have that problem with me and tell me, and let's resolve it. That's not what he's done. And when you don't communicate and you kind of cocoon yourself, that's where you get leak issues like this. Look, I heard a story from the Technology Policy Organization where they were leading people out in plastic handcuffs, right? They thought they had leaked, and they said, you're fired, right? We'll take your stuff. They put them in handcuffs and do a perp walk last week, 2 weeks ago. Right? That's not how you send a message of inclusion. That's not how you communicate with the people that you want to get to follow you and follow your lead, so you have a common goal you can accomplish.
What about communication skills? Because obviously that's something that he prides himself on. He was obviously able to communicate with enough voters in enough states to become president.
Yeah, I mean, you know, rallying the crowd and putting together a hype video and managing and leading people are two different things. You know, when it comes to communication skills, you know, have you seen him answer any questions? What's the one topic you look at him and say, boy, he has in-depth knowledge? And at some point you have to, and I said this to him directly, at some point you have to communicate an understanding of the issues. That's where communication skills are critical. Now we're seeing, you know, again, I use the word cocooning. They're cocooning him so he doesn't have to address and actually answer any questions. And when you look at and read about the meetings he has with business leaders or other organizations, it's always the same thing. Tell me what you think. Right? It's never, let's have an in-depth conversation. Let's get to the core of a matter. You don't ever hear him saying, let's discuss the 3 R's of Obamacare, right? Let's discuss the issues of the new Paul Ryan proposal. And here's what I disagree or what I agree with. It's always top line. It's always superficial. And if you can't delve into the issues, how are you going to come to a resolution on anything?
But you give him credit for the fact that the Dow is up, unemployment's down,
I do, right?
people
And I
are
was
hiring.
wrong, right? I really thought that because of the uncertainty, the market would not react as favorably as it has. So I was wrong there. But at the same time, yeah, he's, you know, people's spirits in the business world are lifted, and he gets credit for that. But again, and I'm not trying to, look, I hope it continues. I don't want it to go backwards. I'd like to see the Dow go to 25 and 30,000, and I'd like to see the economy grow at 4%. And if I'm just the guy that's wrong and he picked it right and I got it wrong, more power to the country. But the reality is, it's all still based on talk right now. It's all still based on projection. He's got to follow through and get these things passed. You know, if the repeal and replace for Obamacare falls apart and there's not the support for Obamacare, there's going to be issues. If the corporate tax proposals for tax cuts that he's suggested don't occur, we're going to go backwards quickly. And so he needs to fulfill those promises.
Before he ran for president, he talked about there being a bubble and that the market was going to go down. And I am starting to hear, as I'm sure you are too, concerns that the government, that the Fed isn't paying enough attention to the housing market, that some of the same mistakes that were made previously are being made again. Do you have any concerns about a bubble?
Well, there's two different things, right?
I know there's two different things, but any sort of economic down.
Well, look, the market's gone forward very quickly, and whenever that happens, the opportunity for a decrease goes up significantly, right? And the issue now is, now that we're at 21,000, a 10% decline is 2,000 plus points. Right, and that could freak people out, even though it's still only 10%. So is there an opportunity? Yeah, I mean, I was hedged before, I'm hedged now, meaning I haven't sold everything, I haven't protected it, but just in case I have a little bit of downside protection. So I think that's a possibility, but predicting a market, that's almost impossible.
What about the housing market? Are you concerned at all about that?
I haven't seen anything to suggest. In 2006, you would talk to everybody and anybody that you knew, and they were discussing buying a house and flipping it, or they had 3 houses they had mortgages on, or they went to Trump University and learned how to flip houses. You just don't hear that kind of stuff anymore.
One thing that I think Donald Trump will have done when his effect is measured is a lot of very wealthy, successful individuals in business will probably run for office more, maybe even president. We've seen Mark Zuckerberg maybe sending out feelers. Tom Steyer, I think, is probably interested. What about Cuba in 2020? Is that a possibility at all?
I mean, I don't want to say no, but it's not my dream to be president of the United States. I mean, would I like to have influence? I love helping entrepreneurs. I love helping create jobs. I like helping to spur industry, and I'm good at that. If I can continue to do that, I'm happy. But if I think there's a need, because I think one other significant issue right now, he's technologically illiterate. And we're about to go into a period with machine intelligence, artificial intelligence, machine learning, deep learning, those things, where we literally are going to see a change in the nature of employment. And so these companies that he's building factories with, don't pay attention to the number of jobs he's saying for the factories. Pay attention to the number of jobs there are in those companies 2 and 3 years out. I guarantee you they're going to be 30 and 40% lower.
Mark Cuban, always a pleasure. Thank you, sir. Good to see you. And good luck against the Wizards.
I'll take it.
The president is on the road talking to voters, but he's not talking about the health care plan his White House supposedly helped write. Did the Trump administration just make the House Speaker's job a little bit tougher? House Speaker.
Thank you, Jake. I've been using that quote a lot lately, actually.
I'll bet. I want to get to health care in a second, but first there's some news from Capitol Hill today. Congressman Devin Nunes, the chair of the House Intelligence Committee, confirmed that there's no evidence to support President Trump's claim that President Obama had him wiretapped at Trump Tower. Take a listen.
You have to decide, as I mentioned to you last week, are you going to take the tweets literally? And if you are, then clearly the president was wrong.
Shouldn't President Trump expect that the American people are going to take him literally?
Well, sure. Look, I don't know what he wants to achieve any given tweet. Some of them may or may not be intended to be interpreted that way. But look, I think our chair and the ranking member, Devin and Adam, gave the facts. I got the same briefing, and they are still doing their investigation, all things related to Russia and the election. And I think during their investigation, this is information that they thought was important to shed light on. So that's what they did, and I support what they've done, and I support their continuing investigation in this entire episode.
The president addressed this in an interview with Fox this afternoon. He said the word wiretap covers a lot of different things, and that people are going to hear about some very interesting things in the next few weeks. Do you have any idea what he's talking about?
Well, I just say that the intelligence committees are doing an ongoing investigation about all things related to Russia and their involvement in our elections, their attempt to meddle in our elections. So that's probably what's being discussed is, we've had an investigation for quite a while, actually. This isn't just something that just got started. It's continuing on. So perhaps what he's talking about is the continuation of the investigations by both the House and the Senate Intelligence Committee, which are bipartisan investigations.
But just to put a button on this, nothing that would suggest President Obama had President Trump wiretapped at Trump Tower, as far as you know.
That's correct.
Okay. Let's move on to health care. In January, President Trump told the Washington Post, quote, "We're going to have insurance for everybody." There was a philosophy in some circles that if you can't pay for it, you don't get it. That's not going to happen with us, unquote. The Congressional Budget Office, of course, says that there will be 24 million more uninsured Americans under your plan by 2026. I know that you dispute those numbers, but certainly what you're proposing, whatever it is, would clearly break President Trump's promise of insurance for everybody.
Well, that's if you believe all these analyses. And what I mean when I say that is, what the CBO also said is we would reduce premiums. Our reforms, when they kick in, actually lower prices. So what our goal here is to give everyone access to affordable coverage if they want to have it. What the CBO's analysis tells you basically is if the government stops forcing people to buy something they don't want to buy, then they won't buy it on a voluntary basis. That means so those people will choose not to take a benefit they could otherwise choose to take, but they've chosen not to take it. So the point we believe is instead of having a government one-size-fits-all mandate system, which is currently in a death spiral, which is what Obamacare is, repeal that and replace it with more competition, more choice, lowers costs, lowers prices, and gives everybody better access to a more affordable coverage. You combine the federal, you combine our bill, which has tax credits, risk pools, health savings accounts, that dramatically expands people's access to affordable health care coverage for those people who do not get health care from their jobs, which is what we've been talking about here. Remember, Obamacare is about 4% of Americans. 4% of the country are on what we think of as Obamacare.
Right.
Yet Obamacare blew up the entire health care system. It made all health care more expensive for the rest of the individual market and for the employer market. And we have Medicaid currently on an unsustainable path such that a lot of doctors don't even take Medicaid anymore. So this thing is broken,
right,
and we've got to fix it with something better, and that's what we're trying to do.
Well, let me ask you, because you talked about that many of the people who will not be insured anymore will be uninsured because they voluntarily get off the system because the individual mandate will be over. Now, you and I are both old enough to remember that the individual mandate was originally a Republican idea.
Yeah, Heritage Foundation came up with it. I actually don't agree with it. Didn't agree with it then, don't agree with it now.
Right, but it was supported by people like Bob Dole and Chuck Grassley and Orrin Hatch, and the idea of it was personal responsibility, essentially outlawing freeloaders, the people who can afford to buy insurance, but they don't buy it, which means that people like you and I, poor schmucks who actually buy insurance for our families, we subsidize them. Why should people who are responsible subsidize those who aren't?
It's an excellent question. It kind of goes to the heart of the debate here and the difference between our two approaches. So on this idea, the one you just advanced, which is actuarially on paper, it makes sense in your mind, right? If you force younger, healthy people to buy insurance, you'll force more money into the pool to pay for the older, sicker person. The problem is that doesn't work. It doesn't work in practice. It's not working now. It's in a death spiral. So here's our approach. We think the smarter way to go is to open up choice and competition, let more plans be offered, people buy what they want, and that's why we are big believers in state-based risk pools. By having federal financing to help states set up risk pools where you actually cover the catastrophic costs for people who have catastrophic illnesses, people with pre-existing conditions, you directly cover those expenses so that person with a catastrophic illness doesn't go poor when they get sick, but also by covering it directly, you're taking that cost out of the other pools. You're dramatically lowering the price of health care for everyone else so that it's affordable for everybody else. We think that's just a smarter way to go. Target those pre-existing costs, make sure that those people get the care they need, and so the insurance pool that you're buying, if you're not in that category, doesn't have to cover those costs, and therefore it's much more competitive and lower in price. We think that's just a smarter way to go, and we think people will want to participate in that kind of a system. And that's why if you don't get job-based insurance, then you don't get any tax benefit to get a health care plan. With what we're proposing, equalize the tax treatment of health care, so that if you do not have health care from your job, you also get a tax benefit to buy in a functioning open marketplace where the catastrophic illnesses are not going to have to be borne by your insurance or your pool. The risk pools kick in and catch that. Now here's the problem, Jake.
Right.
That took me like 12 sentences to explain. That was hard to get through.
Right.
But we think this is a smarter way to go, and it gives you more market freedom. It gives you more flexibility. It has more competition so we can have better innovation in healthcare. The alternative is the status quo, and the status quo is just in the middle of a collapse.
But I don't want to spend the whole time talking about it, the individual mandate, but your argument is basically, just to correct me if I'm wrong, that the people that I just called freeloaders who can afford insurance but don't get it, that they will just find the new healthcare system you create so compelling that they will join it.
Yeah, they're not going to buy insurance that's so expensive that it doesn't make sense to have it. Right now, what's happening is healthy young people are saying, this stuff is way too expensive. The deductible is 3 times what it is in a job-based plan. The premiums are going up double digits every year. I'm not buying it. I'll buy it when I'm sick. That's what's happening right now. That's why this thing's in a death spiral. But if you give everybody an advanceable, refundable tax credit, to go buy a basic plan of their choosing in their state, which now has free market health care, because we're going to let the states set up free markets in health care, and you have risk pools so that you cover that person with catastrophic illnesses. That stabilizes the market. That brings down prices. Don't listen to me. CBO says it as well, that will bring down prices. And that's before Tom Price, the Secretary of HHS, brings forward a lot of reforms that let the states go back and open up market-based healthcare systems. So we really believe these two combinations, this bill and what HHS can do to deregulate the market and allow more plans to be offered, will be very, very successful and helpful.
Let's talk about the politics of this if we can. You say that you and the White House are on the exact same page. How can you say that with all the distancing that we see that those close to President Trump or supportive of him right now are doing about your legislation? His friend Christopher Ruddy says the House Republicans are doing Trump a disservice. Trump strategist Stephen Bannon's website, Breitbart, attacks you day after day. You really think that you and the White House are on the same page?
I actually do. Look, those websites have been attacking me from day one anyway. I'm used to this sort of thing. This is the kind of thing that you deal with in this kind of a job.
But they're trying to get the grassroots to oppose your bill.
That is not where the Trump White House is. The president's going to be talking about this tonight in, I think, Tennessee. We're working hand in glove with the White House. We meet with them constantly, daily. We worked on this bill together. We jointly drafted this legislation, House, Senate, and White House. So we are working on this together. The president's all in on this. Mike Pence is coming to our conference tonight to talk to it. The president's been bringing members of Congress down to lobby them to support this, to help them support this. He's been calling people. So they're fully invested in this. Whether or not people on the outside do this or that, that's just really not something under our control or something, frankly, we're worried about. Vice President's coming here tonight. Tom Price is coming here the next day. The president is making phone calls. He's talking about this. He's traveling on this. We are all in this as a team together.
He just gave a speech in Michigan. He didn't mention it once.
That's because he was going to do CAFE standards. You're not going to go and make an announcement on CAFE standards in Michigan and step all over that story with something on health care. That's what he's going to do later, I think, in Tennessee, if I'm not mistaken.
It seems like a guy that can bring up more than one subject in a speech. But let me talk about the House and Senate and where the bill is right now, because there are a lot of people who say if it was brought up right now, it would not pass the House and it would not pass the Senate. Listen to Senator Rand Paul from Kentucky talking to CNN about the bill and about President Trump.
Paul Ryan's selling him a bill of goods that he didn't explain to the president, that the grassroots doesn't want what Paul Ryan's selling.
Now, I know you disagree with that, but let me ask you a more substantive question. What changes are you willing to make to this bill to help get it passed in the House and Senate?
Frankly, I think that's kind of an insulting remark to the president, as if he doesn't know what he's doing or something. It makes it look like, I find that kind of puzzling, number one. Number two, this plan, the one we're passing, it's the one we ran on all of 2016. It is based upon the Tom Price bill, which was seen as the conservative gold standard. It's a bill that had about a dozen study committee, or a dozen Freedom Caucus, and many more conservatives co-sponsoring. So this is what we ran on. This has all along been conservative fiscal policy for health care. And so where we are is we're in the legislative process. It's a 4-committee process here in the House. We're working through that process. We're constantly getting feedback from our members. We're making fine-tuning. We're making changes to the bill, keeping all of the main pieces intact. But where we can improve the bill and make fine-tuning pieces of the bill, that's exactly what we're doing, because that is the legislative process.
Can you give me an example? Give me an example of something that you think can be improved.
We want to, Medicaid flexibility is a good example. Giving states better chances at more flexibility. Those are the kinds of things that members are constantly giving us feedback, and we're constantly incorporating that feedback as this legislation moves through the process. Let me say something about senators. You know, senators aren't helpless to the House. Once the House is done with a bill, we send it to the Senate, and they take it from there. So if a senator doesn't like a provision in this bill, or this bill at all, the senator can amend the bill. They're going to have this thing, they call it vote-a-rama, where they have all these amendment votes on this bill when it goes over there in the Senate. So the Senate will take this baton when we hand it to them, and then they can do things to this bill. They can change this bill. They can amend this bill. That's the legislative process. So as far as the House is concerned, we have consensus, and we're fine-tuning our consensus, going to the goal line with our president to get this done, and then it goes over to the Senate, and then they start over there.
You have consensus, so if it came up in the House this afternoon, it would pass?
Well, it's not coming up this afternoon. It's going through the legislative process. That legislative process has not been finalized. So that's kind of a, no offense, kind of a goofy question or faulty premise, because this goes through 4 committees. We've gone through 2 so far. By the way, the 2 committees it went through, unanimous Republican votes in each of those committees. and those committees compromise a cross-section of our House majority. So we feel we're in a very good spot, and we're making it even better by getting feedback from our members and working with the White House to make it better. But then when we're done with the House, it goes over to the Senate, and we'll see what they do.
And you know that you've heard from some of your members talking about their concerns about the effect it would have on older Americans, those who are older but not yet old enough to receive a Medicare. CBO said that your health care plan would greatly increase costs for older Americans. As it stands right now, according to CBO, a 64-year-old making $26,500 a year would pay $1,700 for coverage in 2026 if Obamacare remained because of the subsidies that senior would get. But under your plan, CBO says that that senior would pay more than 8 times that, $14,600, because the refundable tax credit that you're proposing would not offset as much of the cost. And this is why, as you know, AARP opposes your bill. 2 problems with that analysis. You said if Obamacare remains. Let's just say we do nothing. Obamacare will go away because Obamacare is in a death spiral. 5 states, 1 insurer left. Over 1,000 counties, 1 insurer left. Humana just announced they're pulling out of Obamacare because they too lost too much money. So those people don't get anything left. So Obamacare, this is a faulty comparison in my mind because it's comparing us to a law that we know can't last. And more importantly, we're not making people buy Obamacare plans. So we're going to let people buy what they want to buy. So that's the whole point. You're saying, oh, this tax credit only goes so far if you force people to buy an Obamacare plan. I didn't say it. CBO's.
No, I know. I'm saying, but we're not going to force people to buy an Obamacare plan. That's the point I'd make.
But do you dispute the fact that health care costs would go up to $14,000 for that senior?
No, because you're missing the premise of my argument, which is our goal is to lower the cost of health insurance. Our goal is to increase quality and have more choices and lower the cost. Let me say it this way. President Obama promised, if you like your plan, you can keep it. That didn't come true. He then said it's going to lower premiums on average $2,500. It went the opposite direction. Premiums went up something like an average of $3,000. So that didn't work. We're not going to keep us on this escalator of higher costs and a collapsing healthcare system. Our whole entire plan is to lower the cost of that so that you stretch your healthcare dollar further. That's the entire premise of our reforms. Repeal this law, replace it with something that works, so we actually get costs down. And if you get costs down, you improve access to quality care.
Speaker Ryan, let me just ask you one unrelated question, because the deadline to raise the U.S. debt ceiling is tomorrow. Is your party going to raise the limit by the deadline tomorrow?
They don't need to raise it by the deadline tomorrow. The Treasury Department has quite a few things that they can do, which will last months, to do certain moves to make sure that that doesn't happen. I forgot exactly the tool we use. And we're going from Russia to healthcare to debt limits. So the Treasury Secretary has told us we don't have to do it tomorrow. We've got plenty of time to sort this out.
Will your party raise the debt ceiling?
We will work with our colleagues in both the House, the Senate, Republicans and Democrats in the White House to come to a conclusion to this. We're not going to have a default on our debt, and we will figure out how best to deal with this issue when that moment arrives. And that moment, statutorily, I guess, I didn't even know that arrives tomorrow. Steve Mnuchin, our Treasury Secretary, has told us we got plenty of time to figure this out.
House Speaker Paul Ryan, always a pleasure. Thank you so much for coming and taking the questions. We appreciate it.
Thanks.
That's it for The Lead. I'm Jake Tapper. Be sure to follow me on Facebook and Twitter at Jake Tapper. Tweet the show at The Lead CNN. And for more on what happens next with Obamacare, join a CNN Town Hall with Department of Health and Human Services Secretary Dr. Tom Price. It all starts this evening.